One of the things I like most about Survey Vitals is that if I need something different in my product, or if I need to talk to somebody about how to use it better, they're easily reachable by phone. They're available. I've had tremendous support from Bob and his staff. They understand that this product won't work if it's not easy to use, and that they're not available for feedback. Whenever I've had a chance to or need to call somebody in the past for support, they've always been right there. Emails are answered within 24 hours if I have an issue or a question. So not only are they responsive, available, they're highly professional, and they are there for me. They're responsive to my needs, and that is something that you don't see often. It's not something that you'll send a request in and maybe the technology staff will get back to you within 3 or 4 weeks and you'll have your answer. If you need something or have a question about one of their products or about something on the survey instrument itself, then they will listen. They've also, as the short time I've been with them for 2 years now, I've seen them improve their product also. Listen to suggestions. They've shortened the survey in some respects to make it easier of use. I know in the future they're going to have technology versions for your iPhone and for your iPad. The survey may be taking less than a minute, so a patient can walk in the room, do the survey, which they don't like to do typically. One of the survey questions said, this patient said, I would like if there were no more surveys. But that's because additional surveys are long, cumbersome, and not easy to use. That's not the case with Survey Vitals. It's easy to use, done quickly, and the patients really don't mind doing it because it's something that they understand that we need. Plus, I think surveying your patient does show them that you care. And again, they won't know, really care how much you know until they know how much you care. There are many features of Survey Vitals that are available for your use, and you can customize the program to you want. You may just want your basic patient information, but there's a wealth of other resources out there. There are checklists that can use to remind you when certain tests or surveys are due, for either for your staff or for your patients. There's also checklists on the patients at medical home to make sure that you're meeting certain criteria and you're following the guidelines like you should. And when you might need to survey your patients again to get that information. So I find it a valuable tool to help us really understand where we are and where we're going. You cannot change your organization unless you know what's happening in your organization. And for too long, as physicians, have not done that. We have not taken charge and really totally understood what's going on in our organization. The time has passed. If you want to change the way you deliver health care, if you want to improve the care that you give to your patients, you have to be responsive to them, you have to listen to them, you have to understand what they're saying, what they want, what they need to improve. But you also need to get your staff on the same page with you. You can't do that overnight, but you have to start by understanding what they need. And you can't understand what they need unless you ask them. And this is one way to do this, is through Survey Vitals.